I think it's important to have these daily updates because there's so much floating around on social media, and it's important just to provide information to people so that they will have it. So let me run through a few of these things, and I'll be followed by Dr. Persse, and then be followed by Chief Buenik over the Office of Emergency Management, and then Chief Pena and Chief Fenner. Steve Williams, of course, is with the Public Health Department for these individuals. I certainly want to thank Councilmember Kubash for being here as well. Let me just kind of give you a status report. Houston has its 4th case now, and in the city of Houston, this is number 4. And again, this is a case that is related to an Egyptian cruise line. Okay, international travel on an Egyptian cruise line, and so for the city of Houston, that's number 4, which means that I think all of our cases have had some connection with travel, and I think it brings us up to the total number of cases in our region to 20. And so let me just stop and again remind people, international traveling right now is just not a good idea. In fact, just traveling, outside of the state right now is not a good idea. And so I've indicated to City of Houston employees, for example, all international traveling has been suspended until further notice, and all domestic travel must be approved by me before anyone leaves the state. So again, 4th case, but internationally connected, related to an Egyptian cruise liner, and the person is between 65 and 75 years of age, and is at home recuperating. Okay, did not require hospitalization, and she's at home, and Dr. Persse can further elaborate on that. Let me just say, with respect to testing, a number of us met earlier this morning at the Texas Medical Center. We do anticipate expanded testing to start next week in the city of Houston, and so we're ramping up to for that. And so that should start sometime next week. Even as now, we've been able to double our capacity for testing with the Houston public public labs, and Steve Williams can speak to that end. But we have double our capacity for testing internally, but we are anticipating expanding testing capabilities, working in collaboration with the Texas Medical Center on next week. As you know, the zoo is closing as of 7 p.m. Today, and will reopen on April the 3rd. And then with respect to our senior nutrition sites at Sunnyside, Northeast, and Hiram Clark Multi-Service Center, instead of the seniors having to come to those sites, we will be delivering meals directly to them at their home. So we're gonna bring the meals to the seniors instead of having the seniors come to the multi-service center. That's at the seniors who normally go to Sunnyside, Northeast, and the Hiram Clark multi-service centers. We're also kind of streamlining some of our services, recreational services from Parks and Rec. We are continuing, though, any programs that involve children nutrition programs or where meals are provided. We're going to continue that through our Parks and Rec. We're not going to close those programs down. And then let me also speak to this, because it's been on social media quite a bit, that the city is shutting down. Let me be very clear, the city is open for business, and all employees are expected to be at their respective posts. I will be walking the halls, and out in the fields. But the city, because it was trending out there, the city is open for business. Now, we are reducing or rescheduling or canceling events that the city is producing or sponsoring or permitting, but beyond, and we are restricting certain initiatives or programs like recreational programs, things of that nature. But other than that, the city is open for business. Employees are expected to come to work, but we'll all be very responsible in terms of how we do things. And that is, we're not going to be engaging in shaking or hugging, and we're going to exercise some space as we do our work. But the city is open to business. There will not be any municipal jury selection, though, for next week. And so we're going to cancel jury selections for next week. And it pretty much coincides with regards to the fact that we're out on spring break anyway. There are no city council meetings next week, no public sessions, no city council meetings. But that was already scheduled. And so in addition to that, there will be no municipal jury selection on next week. With regards to faith-based organizations and things of that nature, I had a conference call with many of our faith-based leaders this morning, and one of the questions was, Mayor, what are you suggesting or recommending as it relates to church or going to worship service? And what we've said, we've not given out any directive as to you're not meeting, and so what I indicated to them. That is the decision that everyone must make, okay? For those churches, for example, like Lakewood, decide that they're going to have online services on Sunday, that's fine. If you want to go online, that's fine. For those faith-based institutions that want to meet in person, then I offer the following recommendations. Number one, no handshaking. Number two, no embracing, hugging, and three, social distancing or spacing. So don't be right up on one another, kind of spread out. The same things that I'm telling my city employees and telling others: no handshaking, no hugging, and social distancing and social and spacing. The reality is, for me, those who are very familiar with me, Sunday I will be at church myself. I will be there because it is one of those opportunities. Number one, pray for our city, pray for our country, and to be very thankful for the blessings that we have received. But we can do it responsibly. Okay? So if you want to go online, faith-based institution, understand that, please do so. If you're going to meet in person and worship in person, then there are certain guidelines: no handshaking, no hugging, and social spacing, social distancing. It's very, very, very important, and sanitizer and all of those good things. With respect to businesses, been hearing a lot even on social media. Mayor, you're saying close down. No, we're not giving any directives to private businesses to shut down. Restaurants, we're not telling you to shut down. What we are saying, again, be responsible, because we're still a city, we're still moving forward. A lot of events have either been rescheduled or have shut down. And so what we're telling people to be responsible. We're not saying to businesses close. I'm not telling you not to go to restaurants, not saying that. But we're simply saying, please be responsible. And then on the grocery stores, I just can't even, the mayor can't go to the grocery store and find stuff on the shelves. So let me say this. I know there's a lot of angst, anxiety, and people fearful of this virus. But there's no need to go and bum rush the grocery stores. Let me say to you, the water is safe. The water is safe. If you even late on your water bill, we're not going to turn off your water through April the 30th. We're not going to turn it off. And the reason is real basic. We want you to be able to wash your hands. Regardless of your social economic status or your condition, your hardship, we're not going to turn off your water. And Houston's water is safe. So you don't have to go and buy several packages of bottled water. You can brush your teeth with the water coming from Houston. The water is safe. All of these other items. And again, I'm going to stick with my toilet paper. There's no reason to just go and buy it in large quantities, okay? And so let me encourage people, we are taking this coronavirus, COVID-19, very, very seriously. But I also want people to take a collective breath, because again, I don't want the fear of this virus to do more harm to us than the virus itself. Do we anticipate more cases? Yes. Are we taking every measure to slow the progression so we can flatten it out and it doesn't overwhelm our medical health delivery system? Yes. But there is no reason at all to rush the grocery stores. And having said that, let me stop, and now let me bring up Dr. Persse.
Thank you, Mayor. So today, the Houston Health Department reported another case. This is an adult between the ages of 65 and 75 who was on a river cruise in Egypt. It should be noted that this is a different river cruise than the original cruise, which was several of our first cases. So this is a different cruise from Egypt. The patient is, the person is actually doing quite well and is at home. And of the 4 cases that we currently have in Houston, they are all doing quite well and they're all at home. And we're glad to see that. I want to point out that I know that people are paying a lot of close attention to the numbers, and so some of our current Houston cases are actually at the point now where we're testing them to wait and to see when they no longer are shedding virus and they no longer need to be isolated. So they're improving to the point that they will soon be dropping off our list. So you're going to see our numbers go up, and then you're going to see our numbers go down and fluctuate a little bit, and that may be confusing, but that's because as people are able to return to a regular lifestyle. So bear with us, that'll be a little bit confusing, but we're going to be talking about the cases that we have that are current active cases, and I think it's important that everyone know that in a city of 2.3 million people, we have 4 cases. And while we're doing a lot of measures to reduce the spread of the virus, as these numbers remain low, that is exactly what we intend to happen. So the mayor and the judge have been very aggressive and early, which is what we've advised them to do. If we're going to slow down this virus, you can't wait until you're behind the curve. You have to stay ahead of it. And so right now, if the numbers are low, that's a good thing. That's exactly what we want. I'll also point out that today, Galveston reported their first case. And so, again, that's not a surprise that we were going to see more cases. But the whole point is that if they come in small numbers every day, that's exactly what we want to have happen so that the healthcare system can handle that burden. The mayor mentioned that we've doubled the ability to test, and we will be hopefully increasing that even more as we start receiving some more equipment to be able to do more testing. And then finally, I just want to point out the issue of social distancing. And you'll notice that even here today, the folks behind the mayor, we've got a couple more inches between us than we have in the past. And I want to also point out that I've noticed that a lot of people have, as the mayor pointed out, stopped handshakes and stopped embracing. And while that's unfortunate on one hand, it's exactly what we need to have happen. And so I'm really proud of this community, and I'm proud to be a member of this community, because once again, when faced with adversity, we're seeing Houstonians to the person are stepping up and doing the right thing to protect themselves, their loved ones, their family members, their neighbors, and their coworkers. Thank you, Mayor.
Thank you. And we'll say that as we do more testing, we're going to expect more cases. Okay? We're going to be in this for a little while. And I do want to underscore this. This is not, 1 week and done. As we do more testing, we certainly will be expecting more cases. But at the same time, let's be very measured in our approach as we go forward. Chief Buenik with the Office of Emergency Management.
Great. And thank you, Mayor, for your leadership and guidance, not only to us, the department directors, but also to the citizens out there for providing the factual information and the transparency to keep everybody informed on this matter. This afternoon, or actually this morning, the city's Emergency Operations Center increased its activation level to level 2. That's enhanced steady state. We've been working on this coronavirus issue for the last couple weeks, and it seems like each and every day we've been working a little bit harder, so we're monitoring and coordinating resources 24/7 until we get a good handle on this issue and the cases start getting down. As far as some of our task forces that we're working on, one is very important, our PPE task force, that's personal protective equipment. This afternoon we sent out a STAR request, State of Texas assistance request for additional PPE equipment since the governor and the president declared the disasters and emergencies. So we're hoping to get some additional equipment. Right now, We've already checked and surveyed with the medical profession through SETRAC and through the TMC hospitals and through our city departments. We do have enough of PPE equipment for first responders and hospitals, but if this issue goes on the long term, we're going to need some additional assistance from the state and federal government for them to open up the strategic national stockpile to get us some additional equipment to keep our health professions and caregivers safe. A couple other things we're working on in the city. We're making sure that all the city facilities are cleaned and sanitized. Our Metro bus, we've been talking with Metro. They're doing enhanced cleaning services. And then lastly, the mayor mentioned the food supply and the issues at the grocery store. For the past week, we've been meeting. We have a supply chain management group that involves all the local grocers and distribution centers. I was on the phone this morning personally with HEB. They've reassured us that they have ample supplies, just like the mayor said. They're not running out. Their shelves are running a little bit low, but that's a replenishing issue. They're working 24/7 to keep the stock rolling. They have plenty of resources to make sure that everybody gets fed and has plenty of water in the near future.
Thank you. I will add that as we do this expanded testing, though we have some PPEs, personal protection equipment, in-house that we've accumulated over the years. On Saturday of last week, as I indicated before, we sent 10,000 N95 masks over to the medical center. And based on the conversation we had this morning, as we go to this expanded testing, literally you could utilize thousands of PPEs in any single week. And we're not going to be able to just wait on federal supplies to come. We hope that they will come. And so I've indicated to Tantra Emo, the finance director, and as I indicated to Councilman Kubash not too long ago, that we will have to probably tap our economic stabilization fund to procure PPEs for our testing. So that's going to place a financial strain on the city, but the testing is important in keeping people safe. And as you know, right around the corner, of course, is hurricane season. So we just have to do what you need to do with the situation before us. Chief Pena, the fire department.
Thank you, Mayor. So I'm going to give you a quick briefing as far as the fire department's operations and what we've done to prepare for response to the coronavirus. The fire department and the 911 communication center has already made some changes to the call query protocols. So we're asking certain questions. Again, it's to gain situational awareness for our firefighters. And as we gain that information, we pass it on to our first responders, our EMS personnel, our firefighters, in order to prepare them to have a heightened sense of awareness on certain flu-like symptom calls and the sick call types. We've also made some adjustments to our equipment caches and what we've deployed out into the field. I can tell you that we have a healthy supply of personal protective equipment. We have over 47,000 N95 masks on hand. We have nearly 3,000 gowns on hand in our warehouse. That's on top of whatever we've deployed to the fire stations already. And we've provided the training and the resources to our firefighters to be able to safely approach these incidents. We've had a number of low-level exposures to our firefighters. Those are self-monitoring, which means they're not losing time at work. We have one that was a medium risk monitoring. That one has resolved. The patient came back with negative, so that individual will be returning back to full duty. And again, it's about being able to provide the information to our firefighters, proper wearing of their personal protective equipment, and approaching these scenes safely is what's going to mitigate exposure to our firefighters and not create a burden for staffing and quarantine. The actions that the mayor has taken in declaring an emergency, a disaster for the city, as well as the governor and now the president, are going to go a long way in ensuring that we are able to access personal protective equipment as it becomes available. One of the issues that everybody is having across the nation is the fact that the supply chain of this equipment, one, it's high demand, and two, the supply chain is not as robust as it should be. So, but thankfully, we've been able to plan ahead. We've been able to purchase some things ahead of time, and which allowed us to do have a healthy supply of that equipment. And you know, again, I think what we've been able to demonstrate here with what the mayor said, what the other city departments have done, is that the systems are falling in place. Okay, and this is a manageable situation. And what I would recommend is that people just use common sense. You know, don't touch your face or your nose or your mouth without washing your hands first. Use common sense, spacing, distancing. That's going to go a long way in limiting the number of exposures, and it's going to go a long way in allowing us to properly serve this city. I want to reiterate, we are not closing down. The fire department is at full strength at this moment. We're staffing every available apparatus that we have in the system, and we're going to continue to do so in the foreseeable future. We see nothing changing as far as our deployment status, how we're deploying, and the equipment that we have available for our firefighters. So, okay.
Thank you.
Thank you.
Chief Fenner.
Good evening, everybody. Thank you for your leadership, Mayor. I don't want to repeat everything that the Chief Pena said. In our response is very similar. We've taken the extra steps, and we're at full force. What I do want to say is, in the city of Houston, we have the best leadership, best city council, best police department, best fire department, best citizens. Everybody just simply got to ratchet down. Let's come together, and I want to hit on the stores again because it's important from a public safety standpoint. What good does it do for anyone if 1,000 of our citizens go in and grab everything out the store, and we still got 2.3 million that we have to get stuff to? So let's be who we are, good loving Houstonians. Let's take care of our neighbors, and let's just ratchet down a little bit. We've put things in place that's going to get us through this just like anything else. So the police department is here in partnership with our great fire department with great leadership, and we're going to move the city forward. Thank y'all.
Let me bring up Steve Williams, who's over our city's health department, who's been kind of monitoring this situation from the very beginning. Director Williams.
Thank you, Mayor. I only have one comment to add on as it relates to the health department's response and responsibilities, in addition to what the mayor and Dr. Persse said. Today, the mayor, thank you, approved an additional to our laboratory staff to ensure that we're able to continue to meet the testing demands that are presented to our laboratory. We're also going to increase our epidemiology capacity, which is responsible for following up on case contacts. Those are the people that are responsible for reporting out the amount of tests that we've done and also the positive results that we've gotten. We also have we've ordered additional testing equipment, anticipating that there will be an increase in demand.
Thanks. So, is this a serious situation? Yes. Okay. Is it going to be with us for a little while? Yes. Are the numbers of confirmed cases probably going to increase in the city of Houston from 4 to a higher number? Yes. Are we taking steps to slow the progression? And without question, yes. And not just the city of Houston, but organizations at all levels. Okay? And we are taking such dramatic steps to reduce people's contact, encouraging people to practice proper hygiene, to engage in distance spacing, along the way. So all of those steps are being taken. It's a very serious matter. We're taking it very seriously. But having said that, for the people in the city of Houston, this is not our first time at a situation of this kind. And we will get through it. But the lesson learned from previous disasters is that we get through it when we work as a unit, when we work together, and when we don't panic. And so that's why, and lastly, I'm encouraging people to get your information from credible sources. And unfortunately, social media is not it. Okay? So get your information from credible sources and not buy into the rumors. City is open, and we're going to proceed. And now every day, every week may be different. And depending on what we see next week, the actions that we take could be different than the actions, or could be in addition to what we have taken this week. But we'll take it day by day.